I think initially when COVID hit, there was a lot of things that we just kind of jumped into action because we had to. There was so much unknown after all of the tasks and the work was said and done. And I think we started to realize just how much we maybe had neglected of our own beings and our own families. What's happening is that you're getting the people you're seeing are really, really sick. And I think there's a lot of frustration with the idea of, if you would have had your vaccine, you maybe wouldn't be so sick. And so there's a lot of feeling like your hands are tied.
And I know that we've already lost staff because I just don't want to go through another influx of it.
Very specifically.
It's never going away. It's still there.
Emotionally, mentally draining. Yeah.
Very, very draining. So, because we've already been through it, and now we already know, oh man, this is how it was. Is this how it's going to be again, or is it going to be worse? And then the added stress is that the departments are short. We just don't have the staff to care for our critical patients that we need.
I think a lot of people are leaving healthcare because maybe they didn't recognize the stressors they were under, and it snuck up and kind of, I think, slapped them in the face in a way. And then they started to realize, I don't know if I can do this anymore, emotionally, physically. I think they had started to think about their well-being emotionally, especially.
Offering our peer support team that we're trying to help prevent the burnout and fill up our buckets again. We've been talking a lot about this, is that our buckets are drained. We can't pour out what we don't have. And we've been realizing this, and we've been pouring out for the last year and a half to no end. And we realize that we can't be the caregivers that we want to be without taking care of our own first and ourselves. So what a pulse check does is a pulse check tries to bring about some relief. It's about 45 minutes to an hour where a peer support team will go and help out that department in whatever area that they need. Whether we're giving a nurse a much needed 15-minute break to use the bathroom, and maybe make that phone call regarding childcare.
We are seeing the physical relaxation and smiles and hearing the thank yous for just the simplest things that we are providing. I'm not kidding. We are able to do something for 45 minutes. Just having some support that we can pour into our staffs with mental health is a huge thing that we would love to see our community doing, and just continuing to say, we're here. We recognize that you're still struggling.
Healthcare providers might feel like we're in this alone because people are like, oh, this is what you signed up for. Well, nobody really signed up for a pandemic. Nobody knew what this all entailed. And we're doing our best, but we need the help. And we are recognizing this. So we are reaching out and asking for the help that we need so that we can continue to serve our community, so that we are one Brookings, we are one community.